So we're here today with Commissioner Lynn Beshear, who is of the Alabama Department of Mental Health. And Commissioner Beshear, thank you, first of all, for joining us on behalf of the entire Yellowhammer team. Congratulations on being named a Woman of Impact. It is an honor for us to be able to tell your story. So thank you for allowing us to do that. And thank you for speaking with us today.
Well, thank you. My pleasure. My honor.
So it seems in the scope of your career, you have had the advantage of being in several different types of settings. You've been in a clinical setting. You've certainly spent an incredible amount of time in the nonprofit sector and done some amazing things there. And here you are currently in the public sector. Are there any principles of leadership that have just been universal across those settings and have really kind of helped you from one setting to the next?
Yes, there are. And thank you for asking that question. I guess the number one thing would be always be truthful and consistent with what you say and how you treat people as much as possible. Your word needs to be your bond. On my very first day of psychiatric training, when I was in nursing school, I learned a principle that has served me well. And that is that the only behavior you can change is your own. And so if you want other people to change, you have to ask yourself, well, what do I have to do differently? That might be behave or treat them in a different way, or share information with them. But the only behavior you can change through nonviolent means, obviously, is your own. What people perceive as happening to them is more important than what is actually happening. And I think this is particularly important when you are dealing with people, certainly with mental illness. That was where I learned that principle in my psychiatric training, but also in dealing with people who may, because of their life experience, feel that they are being discriminated against by race or gender. So their perception of how you are treating them is how they're going to react to you, sort of regardless of what your intent is. But the only behavior you're responsible for is your own. So we cannot take on the blame of the world for things that are not our responsibility, but just work to improve. People will basically react out of two emotions, and one is love and one is fear. And we have seen during this COVID experience, certainly both of those on major display. Unimaginable self-sacrifice and love, and then the reaction of fear-based behavior. One of my favorite things that I have learned in my many experiences is a little saying called DWYSYWD, DWYSYWD. Do what you say you will do. Be dependable. Be dependable. Again, be truthful, consistent, and if you say you'll do something, follow through and do that to the best of your ability. Or quickly communicate why you cannot. Be curious and always be open to new learning and learning from an opposing point of view. You might learn something new. Every experience prepares you for the next one, and I think I'm a living testament to that, because as you said, I've had a huge variety of experiences, from the clinical setting to working in a school to nonprofits and service on any number of boards. And I believe that without any of those experiences, I would not be able to do what I'm doing today here at the Department of Mental Health. If possible, model the behavior that you would like to see in others. We're all basically role models for each other, I believe, in a good or a bad way. And then finally, I would say, as the leader, be willing to take the blame if something goes wrong, and give the credit to others. When it goes well, there is no limit to what can be accomplished when it doesn't matter who gets the credit. So I just share those with you.
No, I thank you for that. And that exposure, tell us about Envision 2020, which seemed like just an incredible project, and your role within it must have been very fulfilling. But tell us a little bit about that project.
Well, I'm happy to do that. Envision 2020 was actually born when Bobby Bright was elected mayor of Montgomery on November the 2nd of 1999. And the reason I remember that so vividly is that November 2nd is my wedding anniversary. And my husband and I were out to dinner that evening when it was announced that he had won, and he had run on several important planks of a platform: downtown redevelopment, public education, and race relations. And I have been involved in Leadership Montgomery and Leadership Alabama for many years. And these were all key issues for the state and certainly for Montgomery as the capital city. And so a handful of us who had been through Leadership Montgomery, Leadership Alabama, uh, came around him and said, "We share your vision. Please let us be the boots on the ground to help you implement your vision." And so a group of about, I don't know, 20 or 30 of us started meeting regularly with him and Judge Bright, Lynn Bright, his wife, who is a judge, and just sort of brainstorming, well, how do we do this? Well, that was at the same time that visioning processes were occurring in other cities in the country. And Knoxville had done one, Birmingham had done one, Mobile had done one. And so we interviewed the same consultants and decided upon the consultant that had done the vision for Knoxville and for Birmingham area. And that's how Envision 2020 was born. And at the time, I had retired, I thought, from my job in a school, and was doing volunteer work, had worked with some people here in the State Department of Public Health and at the Gift of Life Foundation, and we had founded the Montgomery Campaign to Prevent Teen Pregnancy and the Alabama Campaign to Prevent Teen Pregnancy, but that was as a volunteer. And so um, George Goodwin and Todd Strange, who was then the head of the county commission, I believe, had asked me if I would head up this work to do this public visioning process and work with the consultant. And so that was how it was born, really. And we worked with Gianni Longo out of New York, who was with American Communities Partnership. And he walked us through the process of doing public meetings. We held 15 public meetings in 6 weeks in 5 counties, where 1,757 people shared 4,400 ideas about what they wanted for the future of the river region. And all of those ideas were assimilated into 25 goals. And so then my job became putting together the task forces to start implementing the 25 goals. So that's the story on Envision 2020.
And were they successful? What was the outcome?
Okay. My staff was me and an administrative assistant. So yes, so we, needless to say, depended on the volunteer workforce of people who were interested in certain issues. And we rolled out, eventually we rolled out about 12 of the issues. My favorite ones actually had to do with smart growth and new urbanism, downtown and community development. It was fascinating to me to learn about this movement around the country to establish communities that look uh, like Old Cloverdale here in Montgomery, um, where you have very welcoming neighborhoods, you have sidewalks, neighbors know each other, their porches, that sort of setup. You can walk to the corner store or restaurants or things like that. And so I became very immersed in that with the city planning department. Our job in Envision was to do the education piece. We did a major smart growth conference that really launched that work. And one of my favorite stories actually is in our smart growth new urbanism task force. We had 7 subgroups working on all the sub issues. And one of the leaders of that, who is a very prominent Montgomery investor developer, told me, he said, we just can't do this. We cannot even agree on a definition of what we need to be doing. And so I said to him, I said, well, you know, the people have entrusted us with their vision, and it's up to us to implement it. So you tell me the one thing we can agree on, and that's where we're going to start. And this individual said, well, we can agree on preserving our history. So I said, wonderful. You know, and we got so much history in downtown Montgomery. This particular individual ended up, as I said, he's a major developer, putting multi-millions of dollars into Montgomery around smart growth and new urbanism because he caught the vision. He became the leader of it. He understood the value of it. And so that was one of the most exciting outcomes to me. We were asked in 2007 to focus a lot. Bobby Bright was still mayor, and Todd Strange was still with the county commission in 2007. And we were asked by them to take on healthcare. There was a growing realization at that point of the impact of people on hospitals who did not have any means of paying for their care. And of course, hospitals by law cannot turn people away. And so the hospitals were taking a major hit. Hospitals have to pay for equipment and staff. I mean, it's a business at the end of the day. And so we did a major study that revealed that we needed to increase in 3 areas, basically: primary health care, mental health care, ironically enough, and oral dental health care. And so at the same time that study was published was when the stimulus money came along from the sort of the little crash that the country had financially a few years ago. And so we were able to get $11 million. We coalesced a huge group of people. The Federally Qualified Health Center, the FQHC here, applied for that. We raised a couple of $1 million of committed money in a couple of weeks to round that out, and we submitted it, and we were the only project in Alabama that was funded. I think there were 18 projects in Alabama that were reviewed by the federal government, and we were the only one funded. We got $11 million, and we built a federally qualified health center on the campus of Jackson Hospital, which donated the land. Now, that was a massive undertaking, as you can imagine, but extremely rewarding. And then I set about trying to tackle access to mental health care and access to oral health care. And so the work that I did around the mental health care access is what caught the attention of the mayor, not the mayor, the governor, excuse me, from a speech that I made on May the 15th to the Rotary Club here in Montgomery. And I received a call that evening reaching out to me to consider taking this position. And so I loved connecting dots. I mentioned that earlier for people who might not see the connection between healthcare and business and education. And so that's fun to see people engage around that. And then just engaging with people, hundreds of people that I would not have met in any other way except through the Envision process. I got to meet great people in Montgomery, Autauga, Elmore, Macon, and Lowndes counties and work closely with them and get to know elected officials, business leaders. So it's a great opportunity.
And I can imagine that that was such a great preparation for your current role as the head of the
Yes.
department and a servant to all Alabamians. Um, it would seem during this current COVID crisis that your department particularly does have a need to very quickly create and design and implement focused services associated with this crisis to Alabamians. But at the same time, you all are still providing all the regular services across the state that you're responsible for. So any advice for leaders of organizations, leaders of businesses who have found themselves very quickly having to redirect energy, redirect resources for emergent challenges? Any advice?
Well, we have certainly had to do that. You hit the nail on the head. I was really amazed at how instantly, really instantly, our team, our leadership team, came together and based on their experiences and their responsibility, how quickly they put together how we were going to function as a department. It was, I wish that citizens could have seen that level of commitment, of setting aside personal fears and focusing on the goal. First of all, you have to realize you can't do it all. Some of the things that you were doing previously are just going to have to wait. And you have to keep the main thing there as you plan. Because of the fear that has ruled the day around this, it's important to communicate clearly, consistently, and frequently, and at the level that people can understand. Okay. You have to remember, we have to remember this is new to everyone and that people react differently based on their own experiences, their own family situation. And so we have to respect that as leaders, I think. Consistency is important, but in a situation like this, you have to be aware that certain individuals, because their family situation, are maybe having different experiences. Perhaps they've lost a loved one. Perhaps they themselves have been ill. And so you just have to be a little bit maybe more nimble and flexible and patient than in the past. Use your team, trust them, trust their experiences. Resilience, I think, is important. Creating opportunities for others to, problem solve, gather information, And because we're, as I said earlier, we're all in new territory. Um, Set a vision and a tone of hope that we are going to get through this. As painful as it is, if we stay together, we're going to get through it. And it's been interesting to me to see the reaction among my senior staff. And you, as I said, I have to respect that. We early on issued a not a mandate because the governor had not mandated, but I issued a strong suggestion that people wear masks. And we requested that of other people here on the floor where we are, because there are other businesses on this floor in this building with us. And they understood that we in common areas of the building would wear masks, and we requested that they did the same, and they were so respectful, and they have. And so if we can just maybe cut each other a little slack and be respectful and know that this will end, and that at the end of the day, we want to stay as well and healthy mentally and physically as we can.
Absolutely. So I'm sure during that in particular, there must have been an incredible amount of listening. And I've heard you on previous interviews talk about the need to be a good listener when you're in a position of leadership and when you're working inside of an organization. So what about listening in particular do you think has served you well as a public servant?
Well, I will say that service to others is not easy. Okay, um, if you're looking for an easy job, this would not be it. You have to really care, and it's hard work. And sometimes it requires you being patient. You have to be willing to take the hits and bounce back. Um, and you have to understand that when others are talking to you, that they might not have bought into your vision. Not everyone really wants to see progress, I have found. Some people would just rather complain, frankly, rather than say, all right, we have identified that problem. What can we do about that? So in listening, you sort of have to pick through those issues and try to understand what's the intent behind it? What are the issues behind it? What fears are there? Perhaps it's just a fear that they have. Maybe they don't have all the information that you and other people have. And so also, what are that person's values? What are their life experiences? What are their visions for the future? As I mentioned in my little story a moment ago with the developer and the smart growth, always look for the common ground. Listen, and if there's something that gets said that you can jot down as something that you can come back to and say, I've thought about that. I agree with you on that. What can we do about that? And try not to focus on the areas of disagreement. Active listening is important. Your facial expression. Um, are you just hearing words, or are you really listening to what's behind the words? So
That's great.
yeah. Mm-hmm.
Last question. During this COVID crisis, there is now just a much greater awareness of mental health and emotional health. It's on the forefront of most individuals. I can say personally, as a member of a family, as a member of a business, as a member of organizations. So it really is just so much more aware, and it is the topic of the day. Why is this awareness so important? I can imagine you've been singing from this page for a long time now. So why is this awareness so important? And what can you tell us to help keep that awareness up?
Okay. Well, sometimes life will present you with opportunities that you weren't anticipating. And you're exactly right. Our department forever has been trying to talk about the importance of mental and emotional health. And most people don't really want to talk about that. They'll talk about their physical health all day. If a family member has cancer, for example, the casseroles come, the caring, the flowers, the prayer list, all that. But boy, if somebody says, my child has schizophrenia, then suddenly people turn their back. They're afraid of it. And I understand that um, because mental illness affects the brain, which rules your behavior. Um, the behaviors exhibited can be frightening. I think we have to acknowledge that up front. They can be frightening, they can be unpredictable. And if you don't understand what's going on, the natural inclination is to flee from it. If people are, for example, experiencing anxiety or depression, a lot of times that's all they will talk about. And it gets very tiring for other people. So we have to understand that as one of my hospital administrator friends says, mental illness is messy. It just is. Okay, so we have to recognize that up front. All right, so here we are with COVID, where suddenly people are having anxiety about their own health, about their job. Am I going to be able to pay my rent? Am I going to be able to feed my children? What is my future? So a lot of people's anxiety is going way up. And then people who are in these jobs where they're exposed to the virus are exhausted mentally and physically and emotionally from giving and giving and giving. And we heard particularly early on that major news networks did extensive coverage about people in healthcare and what they personally were going through in seeing patients die without family members there, and nursing homes were having people die of loneliness, I mean, it just, so when something is that vast and that universal, you cannot ignore it. So we look upon this as an opportunity to open up the conversation, to really open up the conversation. It's one that we welcome. We would love to engage with business, for example. We have a whole team of people here in our department who are experts on mental illness, on prevention, on substance abuse, and it would be our pleasure to arrange for lunch and learn or in person whenever we get back to that opportunity. But we can certainly do a virtual. Let's see. A couple of weeks ago now, I was invited by the BCA, the Business Council of Alabama, to do a 20-minute, it wasn't really an interview, it was just a presentation that they are putting together with a number of presenters for a conference, I guess, that they are getting ready to have soon. And I was invited to participate in that. And so for the Business Council of Alabama to reach out to us was big. They worked with us to sponsor a survey that's going out to business. I think it closed yesterday, actually, where they give input to issues that they are seeing in their business around mental and physical health, emotional health, and what services are they offering. Now, what service do you offer and what perhaps would you like to offer? So we are trying to collect data because, as we know, the data tell the story, and they are key, they are essential to getting grants and to being able to monitor, well, this is where we were at this point, and here's where we are now. It's either gotten better or not, you know. And so, uh, yep, we look upon this as an opportunity. As sad, we would have preferred a different opportunity, but here we are, and people are reaching out to us, and we know that the impact on the healthcare providers, PTSD, frankly, and which a lot of times manifests after the crisis is over. So we're actually trying to prepare for that eventuality, as well as what can we do to support people who have been through this trauma. And that's what it is. If
Oh,
you're on the front lines, it's a trauma. So,
well, and the services are vital. So I do hope that that exposure to the service, the public service that they are offering, continues. And they've very deservingly been put on a pedestal for being the front lines of this crisis. And so it is wonderful to see that they are being well taken care of across the state. And anything else that we can do to promote that, we would love to. Well, we'll wrap up our interview, Commissioner Beshear. It was wonderful to
thank you.
see you, and we just do hope if there's ever anything that Yellowhammer can do for you, you will just let us know.
Well, we always appreciate the articles that we get and the support that we get. And Melissa Valdez Hubert, is our PI officer, and she does a really good job. So we welcome and appreciate this partnership. And again, thank you for this recognition um, of, of me and of the work that this department's doing. We really appreciate that.